in the hushed corridors of the bustling hospital, where the rhythmic beeping of monitors and the muted whispers of doctors created an orchestration of healing, one figure stood out among the white-coated ensemble. Dr. Olivia Reynolds, a seasoned surgeon with a reputation that preceded her, epitomized the intersection of skill, dedication, and compassion that defined the noble profession of surgery. As dawn painted the sky in hues of pink and gold, Dr. Reynolds navigated the maze of sterile hallways towards the operating room. The familiar scent of antiseptic lingered in the air, a precursor to the demanding day that lay ahead. Her stride exuded confidence, a testament to the countless surgeries she had performed, each one etching its story onto the canvas of her career. A surgeon's journey is a tapestry woven with threads of education, resilience, and an unwavering commitment to the sanctity of life. Dr. Reynolds' path had begun in the hallowed halls of the Johns Hopkins School of Medicine, where she absorbed the intricacies of anatomy and the nuances of medical science. The years of rigorous study, sleepless nights, and relentless pursuit of knowledge laid the foundation for the formidable surgeon she would become. The operating room, with its gleaming stainless steel surfaces and an array of surgical instruments, was Dr. Reynolds' sanctuary. Here, she transformed from a person into a conduit of healing, a master orchestrator in the ballet of scalpels and sutures. Each surgery was a symphony, where every incision, every suture, played a crucial note in the composition of saving a life. The patients who entrusted their well-being to Dr. Reynolds were not mere cases, they were narratives waiting to be rewritten. As she stood in her sterile attire, gazing down at the unconscious form on the operating table, she felt the weight of responsibility press upon her. This was not merely a surgical procedure, it was a lifeline extended, a chance at renewal for the person lying vulnerable before her. Precision was Dr. Reynolds' forte. Every movement of her gloved hands was deliberate, a manifestation of years of practice and refinement. The surgical field became an extension of her consciousness, a realm where instinct and expertise converged. The hum of machines, the controlled urgency of the assisting nurses, all faded into the background as she focused solely on the task at hand. A surgeon's role extends beyond the confines of the operating room. Dr. Reynolds often found herself at the crossroads of empathy and professionalism when interacting with patients and their families. Breaking the news of a diagnosis or explaining the intricacies of a surgical procedure demanded not only medical acumen, but also a delicate touch of humanity. She became a beacon of hope in the storm of uncertainty, offering solace and reassurance to those grappling with the fragility of life. In the dynamic landscape of modern medicine, innovation is the pulse that propels progress. Dr. Reynolds, cognizant of this, embraced the ever-evolving technologies that enhance surgical precision and outcomes. From robotic-assisted surgeries to cutting-edge imaging techniques, she stayed at the forefront of advancements, ensuring that her patients received the best possible care. The camaraderie among the surgical team was akin to a well-choreographed dance. The anesthesiologist, nurses, and supporting staff moved in synchronized harmony, attuned to the unspoken cues of their leader. Dr. Reynolds fostered an environment of collaboration and mutual respect, recognizing that the success of a surgery was not an individual achievement but a collective effort. The challenges encountered in the realm of surgery were not limited to the complexities of the human anatomy. Dr. Reynolds, like her colleagues, faced the emotional toll that accompanied the profession. The loss of a patient, despite the exhaustive efforts invested, cast a shadow over the triumphs. Yet, in the face of adversity, she drew strength from the knowledge that every surgery, successful or not, contributed to the ongoing saga of medical advancement. As the day unfolded, the variety of surgeries Dr. Reynolds undertook showcased the diversity of her skills. From delicate neurosurgical procedures that demanded microscopic precision to the visceral intensity of emergency trauma surgeries, she moved seamlessly between specialties. The operating room became a microcosm of life's unpredictability, where each surgery held the potential to rewrite destinies. The essence of being a surgeon transcended the technical proficiency and scientific knowledge encapsulated in textbooks. It delved into the realms of empathy, resilience, and the ability to navigate the fine line between life and death. Dr. Reynolds embodied this essence, her demeanor a blend of stoicism and compassion that resonated with both patients and peers. In the midst of the clinical rigor, Dr. Reynolds took refuge in the moments of profound connection with her patients. A reassuring touch, a comforting word, or a shared smile became the threads that wove the fabric of trust. Beyond the surgical scars, she recognized the human stories etched onto the canvas of skin and flesh, stories of survival, resilience, and the indomitable spirit of the human condition. The clock in the operating room ticked relentlessly, marking the passage of time in a realm where seconds were precious. Each surgery carried its own chronicle, a narrative of challenges surmounted and victories achieved. The symphony of beeping monitors, the swish of surgical gowns, and the hushed exchanges among the surgical team created a symphony that echoed the heartbeat of life preserved. In the quiet moments between surgeries, Dr. Reynolds reflected on the evolution of her career. From the eager medical student navigating the intricacies of a cadaver to the seasoned surgeon orchestrating intricate procedures, her journey had been a testament to the transformative power of dedication and perseverance. The title of surgeon was not merely a label, it was a mantle of responsibility that she bore with grace and humility. The twilight hours descended, casting a golden glow over the hospital. Dr. Reynolds, weary but resolute, emerged from the last surgery of the day. The weight of her scrubs, soaked with the sweat of exertion, mirrored the intensity of the task she had undertaken. Yet, in her eyes, there lingered a spark, the spark of fulfillment that emanates from knowing that lives had been touched, mended, and, in some instances, saved. The journey of a surgeon is a perpetual odyssey, an expedition into the realms of the unknown, where each surgery is a voyage into uncharted waters. Dr. Olivia Reynolds, with her unwavering commitment and surgical prowess, continued to navigate this odyssey with poise and purpose. The title of surgeon was not a static accolade, it was a dynamic identity forged in the crucible of countless surgeries, each one adding a stroke to the portrait of a life dedicated to healing.